The staff of Rashid would like to welcome Her Royal Highness Princess Victoria of Sweden, His Highness Sheikh Abdulaziz bin Ahmed bin Rashid Al Naimi, Chairman of Information and Cultural Department, His Excellency Dr. Hanif Hassan Ali Al Qasim, UAE Minister of Health, His Excellency Mr. Magnus Scholz, Ambassador to the UAE for the Kingdom of Sweden, distinguished guests, ladies and gentlemen. We are here to showcase our center, which is a UAE Swedish integrated project in the combat against diabetes. On this occasion, I'd like to invite His Excellency Dr. Hanif Hassan Ali Al Qasim, UAE Minister of Health, to deliver the welcome address.
His Excellency Dr. Hanif Hassan Al Qasim, the UAE Minister of Health, gave a speech at the beginning of the ceremony, thanking Her Royal Highness Crown Princess Victoria of Sweden and His Highness Sheikh Abdulaziz bin Hamad bin Rashid Al Nuaimi, Chairman of the Department of Culture and Information, for their attendance and expressed his appreciation for the UAE's wise leadership, for their deep concern towards healthcare in the UAE and the protection of its people. In his welcoming speech, Dr. Hanif said the Rashid Centre for Diabetes and Research was established by a strong public and private partnership, combining the vast experience and dedication of both countries in collaboration with the Swedish firm Global Health Partner. The centre offers the best treatments available for diabetes and obesity, as well as education and research for the treatment and prevention of these conditions. The centre embodies the strong diplomatic relations between the UAE and Sweden, especially in the field of healthcare. He stated that the partnership was established as part of the ministry's strategy to continuously upgrade our standards of care to international levels, with many excellent new services and approaches designed to address the needs of all residents. He said the strategy is supported by His Highness Sheikh Khalifa bin Zayed Al Nahyan, President of the UAE, and His Highness Sheikh Mohammed bin Rashid Al Maktoum, Vice President and Prime Minister of the UAE and ruler of Dubai, as well as their Highnesses, members of the Supreme Council and rulers of the Emirates. The establishment and strong early success of the centre is in line with the ambitions of our rulers and the federal government to enhance healthcare and build strategic collaborations with strong international organisations. The Minister then explained that the Rashid Centre of Diabetes and Research has carried out several rare surgical procedures using the latest medical equipment and carried out by a number of renowned doctors from around the world. The centre has also trained UAE nationals to perform such operations and encourages them to continuously upgrade their skills. He praised the visit of Her Royal Highness Crown Princess Victoria of Sweden and added that such partnerships bolster the country's efforts in fighting diabetes and reinforce the ambitions of the federal government in enhancing the healthcare field.
كما يعكس مدى حرصه على تعميق الشراكة الناجحة بين الإمارات العربية المتحدة شعبا وحكومة في المجالات المختلفة وفي القطاع الصحي تحديدا وفي مجال معالجة السكري ومواجهة التحديات بشكل خاص. إننا في وزارة الصحة نقدر لصاحبة السمو الملكي الأميرة فيكتوريا دعم سموها ورعايتها بالتعاون القائم بين الإمارات العربية المتحدة ومملكة السويد في مجال مكافحة داء السكري. أيها السيدات والسادة، لقد أصبح داء السكري مرضا يهدد الصحة العامة في عصرنا الحديث، وتؤكد الإحصائيات الرسمية وغير رسمية محليا وعالميا ضرورة بذل المزيد من الجهود نحو مكافحة داء السكري الذي تؤدي الإصابة به وسرعة انتشاره إلى ضعف الصحة العامة وقلة الإنتاجية وإعاقة القوى البشرية عن القيام بدورها في التنمية والتطوير. كما أنه يكلف مؤسسات الرعاية الصحية أعباء مالية كبيرة. لقد تم إنشاء مركز راشد لعلاج السكري والأبحاث تعزيزا لجهود الإمارات والسويد وتفعيلا للشراكة بين القطاعين العام والخاص ممثلة في وزارة الصحة ومؤسسة جلوبال هيلث السويدية في مجال مكافحة داء السكري. ولقد جاءت هذه الشراكة واحدة من المبادرات الاستراتيجية لوزارة الصحة الرامية للارتقاء بمستوى الرعاية الصحية وتطويرها وفقا للمعايير الدولية وتفعيلا لرغبة الوزارة بتقديم خدمات صحية متميزة لتلبية احتياجات سكان الدولة من المواطنين والمقيمين. إن مركز راشد للعلاج السكري والأبحاث الذي هو ثمرة شراكة مجتمعية محلية طيبة والتعاون الدولي الناجح ومثمر مع مملكة السويد يقدم أفضل الطرق العلاجية لمرضى السكري والسمنة، بالإضافة إلى أن المركز يقوم بالأبحاث والدراسات العلمية والمجتمعية في هذا الخصوص. وإنه لمن دواعي السرور والفخر أن يكون هذا العمل تحقيقا لرؤية ثاقبة لأهمية وضرورة الشراكة والتعاون المشترك ونهج حكيم رسمه صاحب السمو الشيخ خليفة بن زايد آل نهيان رئيس الدولة حفظه الله، وأخوه صاحب السمو الشيخ محمد بن راشد آل مكتوم نائب رئيس الدولة رئيس مجلس الوزراء حاكم دبي، وإخوانهما أصحاب السمو أعضاء المجلس حكام الإمارات. وها هو نجاح المركز يؤكد فعالية توجيهات قيادتنا الرشيدة ويجسد طموحات الحكومة الاتحادية في تعزيز الرعاية الصحية وبناء علاقات استراتيجية وطيدة مع المنظمات الدولية ومؤسسات الرعاية الصحية المتخصصة مثل جلوبال هيلث. أيها الحضور الكريم، إننا نتطلع لمزيد من التعاون مع مملكة السويد ومع مؤسسة جلوبال هيلث العالمية لاستمرار جهودنا في مكافحة داء السكري والحد من انتشاره في الإمارات العربية المتحدة. كما أود في هذه المناسبة أن أشيد مجددا بدعم معالي راشد عبد الله النعيمي في إنشاء هذا المركز ومتابعة نشاطاته وبرامجه وفعاليته. أشكركم جميعا والسلام عليكم ورحمة الله وبركاته.
We would like to thank His Excellency Dr. Hanif Hassan Ali Al-Qasim, UAE Minister of Health, for his continued support of this project and the Rashid Center for Diabetes and Research. The Ministry of Health makes great efforts in implementing the directives of the federal government and the wise leadership in providing a healthy life for the residents of the UAE. I would like to request Dr. Mahmoud Fikri, Assistant Under Secretary for Health Policies in Ministry of Health, for his presentation on diabetes in the UAE, national plans and the vision for Rashid Center for Diabetes and Research.
Thank you very much. Bismillahirrahmanirrahim.
Furthermore, Dr. Mahmoud Fikri, Assistant Under Secretary for Policies at the Ministry of Health and Chairman of the National Committee for Fighting Diabetes, said the Rashid Center for Diabetes and Research has carried out a high number of very successful operations. He went on to note that the center wishes to provide medical education with Swedish staff training UAE doctors on the very latest in surgical procedures for the treatment and eradication of obesity and its complications.
Board, Administrative Board of this center, and Ministry of Health to welcome Her Royal Highness. And it's our great pleasure and appreciation to be with us here today. In 5 minutes, if your Highness allow me to present what activities we have in this center, just shortly in 5 minutes. Your valuable time. Thank you very much. Diabetes is one of the challenges all over the world. This is one of the challenges to the public health everywhere. Every nation, United Nations, WHO, and every government taking it in very consideration. Here in the Ministry of Health and the government of the UAE also we take consideration about this. The Ministry of Health developed a national comprehensive strategy. That strategy presented to the cabinet and to the government were approved in 2008. Now, this strategy mainly we can summarize it. And the main issue of that strategy to combat the disease in this country. Primary prevention of type 2 diabetes and secondary prevention of type 2 diabetes. Improve and promote the quality of diabetes care. That should be in different levels, primary, secondary, and tertiary levels. Support for monitoring and evaluation of the diabetes. And again, promote and encourage diabetes research, because the research we need the data to build on our future strategy. Empowerment of the patient, not only to give them the treatment, to make their life some kind of quality of life. Because now the life expectancy in this country is 78 for the female, for the male, and 80 for female years of life. So that's if the patient is living with a diabetes, that his years should be a good quality that he can enjoy the time of living. Strengthen the community participation and build partnership for the diabetes control. This is public-private partnership. And this center represents that very clearly, that the center is built by the His Excellency the Mr. Rashid Abdullah as a private support. We are in the ministry supporting the other issues, and the Global Health Service, they are our management company. We are 3-in-1 running this business for the sake of the patient. A significant achievement happened when this center started in June, and that illustrated the distinguished partnership with Swedish institution in the form of the Global Health Partners here. And it's a comprehensive center that it provides both activities, preventive, curative, research services under one roof. And again, we have different classes and different sections. That is for the detection, for the management, for the treatment, and treatment of complication and health awareness, and to avoid the diabetes and its complication, because that is the main strategy here. Now, the service provided at the Rashid Center here, we call it what we call it now one-stop shop general diabetes clinic. That the patient come to the reception, they get information from him, they give him just small card, that card including all his information. Then the patient goes to the center where we will see now where he or she will be examined, and all the data will go automatically into his record. So that everybody in the center, then when they pass the patient, wherever he will stay in any station, then the data will be available there. Special care for nephrology, because nephrology is very important with the, that everybody knows, and the cardiologist. Lifestyle unit and full functioning educational kitchen we have, and group education units. Also that's important because the habit is one of the area where we, of the lifestyle, this is the most important issue in prevention of diabetes, not only prevention and control and management. Diabetes food clinics, this is also one area which is very important because one of the major complications of diabetes is the food ulcer and amputation. So we'll see now how this clinic works during this short time of the operation. Diabetes eye clinic, this is also one of the major complications of the diabetes. So we have the unit where it is for the early detection, screening, management, and including the retinopathy laser unit. Also on the side is scan laboratory. This laboratory here for two purposes. One for confirm diagnosis and follow up the patient, and the other side it will be for the genetic and other studies about the incidence of the disease in this community. Full equipped gymnasium and physiotherapy unit and pharmacy. This is for the service of the patient. The gym here, we put it in this center in order to educate the people how they can make use of that outside the center. Now, the total, every person with diabetes should exercise 150 minutes per week. That means 5 times 30 minutes a day, if he can, or more, but totally should be 150 minutes. And all the studies we've been shown in the last conference that lifestyle is the major issue in controlling of diabetes and prevention of its complication. 80% of the studied individuals show that, even prevention of the cardiac disease. Now these are the team where we passed through them. They are here in the leadership team in the center. Now medical clinic activities over this few months. Total number we have 650, but we receive only patients referred from the other clinic. And this patient, they have the hemoglobin A1C 9 and more. That means they might have 1 or 2 complications with the diabetes. So we handle difficult cases. We don't handle a normal regularity one at this stage now. Now this is 650 through the 5,000 visits. Now we show 90% of our patients are showing this sound improvement of with the 90 with the 65 achievement treatment target goal. Because we want to have that every patient should have his treatment should be on the base level, should not be fluctuating. That is very dangerous for a diabetes patient. So the center was able to serve 5 patient cases below the knee amputation through the adoption international standard management and close follow-up on diabetic food patients, which is very important for his life. The food clinic we will see here that we have 123 patients with the 340 visits. Out of them, there are 35 they had diagnosed neuropathy, and the patient doesn't know that they have neuropathy. But this neuropathy leads them to have the ulcer. The ulcer of diabetes is Bell's ulcer, so he will never feel it, but he will find that there's an ulcer, and that is resistant to the therapy. Now, out of those, we have 20 have had an ulcer, and 8 was vascular insufficiency that the patient cannot walk. Then he will feel severe pain in the leg when he walks. That means blood supply is not going to his leg. So the center has been able to directly save 7 patients with ulcer by treatment, and we will show in the picture, and 21 indirect clearance of the ulcer and avoid the amputation. So this is the clinic where the patient where we take care of the patient, and this is it shows how miserable the ulcer of the leg and after the treatment 3 months after that. Now here we have also eye clinic. As I mentioned, the patient have been screened. We should imagine that 20% of the patient coming to the clinic, they have had some sort of the retinopathy, and they don't know. And this is very important. When they come, you take the fundus picture. We will see now in our round. Take the fundus picture, keep in the record. While he is coming to the clinic, we have to compare from time to time. When we catch the early change of retinopathy, then immediate interference is very important, otherwise you will be blind. So this is a sort of the clinic. Now, bariatric surgery, here also we have one distinguished service. We mix medical and surgical services together. Bariatric surgery shows that the patient will do bariatric surgery to improve the diabetes as well as the obesity. So we have the team, 4 times they came from Sweden. We appreciate their service, and they operate on 26 patients. Out of this 26 patients, five of them were been with diabetes, and they've been completely cured. And these patients, their weight is more than 160 kilograms. Most of them are young, so this is very important. Nowadays we have the team available also here. They are operating today, and we have 12 patients. So we welcome them and we appreciate their service. Now these are the team, and this is the surgeon, how they prepared here. We had our team also along with them, and we sent them to Sweden, to Stockholm, to be trained there for ICU and care of the patient. And then they'll be back here, and they are working together. Now this slide shows the procedure of bariatric surgery. That all the literature says that bariatric surgery is the only therapy that could be considered a cure. As we know that the diabetes is treatment of the symptom, but bariatric surgery giving the cure. When we see the 80% of the patient will be cured from the diabetes and obesity. Now we have here the healthy lifestyle clinic. This is where the people they come and we train them how to do the walking, because more than exertion is not advised, and to be also less activity is not advised. So we have lesson and we have training. Now finally, Your Highness, we are appreciate the service of our colleague here from the Global Health Partner, and they service with us, and we enjoy their services here. Now we are looking to promote PPP, public-private partnership, especially in the area of the research, with the support from the academic Swedish institution. We are discussing this issue between them and between this Swedish academic institution, especially in the area of the cancer, NCDs, and in the area of the diabetes. Expand the scope of cooperation with the Swedish institution to include the other Ministry of Health priority programs. Now, as we know that this year will be a summit in United Nations regarding the national non-communicable diseases. and then the major resolution will be coming about this. So we would like also to have strengthened our relation with them. Lastly, build the capacity of the national medical staff, especially encouragement of the bilateral training program and exchange of the visits of the medical doctors and training in Swedish. Yet we had somebody who went there, but we are looking to have a residency program and to extend that service further. Finally, thank you very much, and I'm sorry to take your time. Thank you very much.
We would like to thank Dr. Mahmoud Fikri, Assistant Under Secretary for Health Policies, Ministry of Health. His encouragement and cooperation has enabled the Rashid Center for Diabetes and Research to become one of the leading specialized centers in the region. Now, I would like to invite Mr. Per Bartelsson, who is the CEO for Global Health Partners, the Swedish company that, in collaboration with the Ministry of Health, has enabled this project to come to fruition to the center as it is today.
Thank you very much. Dear Crown Princess Victoria, Your Highness, Your Excellencies, ladies and gentlemen, I'm very honored and grateful by the trust and the obligation that has been given to us at Global Health Partner, together with the University of Skåne, which means the University Hospital of Lund and Malmö, to actually manage and operate this unique center. This is truly a unique center, as you will see, on a global basis, and it's a unique partnership that we have created, all of us together. The Rashid Diabetes Center, as we see, is truly a multi-skill center with all the specialties that Dr. Fikri just presented. I will not go into that. I will keep my speech very short. You will see afterwards. But we are working in a multidisciplinary way here, around the patient, not only with a multi-professional staff, but also, which is very exciting for us, a multinational staff that adds a special spice to this center. We have also, as you heard, started to conduct research in collaboration with the University in Malmö and Lund, and also with the Sjösta University here. And we are also extending our services to educate primary care staff to take better care of the patients in the communities and try